Hello everyone, welcome to my channel Medico Prime Education. Today we are going to talk about the stomach bed. Basically, what is stomach bed? We know that the structure forming the posterior relation of the stomach. In the paragraph of the stomach, we already know the anterior relation of stomach. Like basically, we do a study about the visceral relation of stomach, like the anterior relation of stomach with anteriorly what the structure present in front of the stomach. We have to study. We already had a study like liver, abdominal wall, anterior abdominal wall, and diaphragm, all like that. But main thing is the most important question comes from the stomach weight. And we also share, I will also share the trick about the trick for the structure for the stomach weight. Okay, so basically, what is the structure forming the posterior surface related to posterior surface of the stomach vein? So these are the structure. I am showing the picture. These are structure forming the posterior surface of the stomach vein. So this is the stomach. I am highlighting the part of the stomach. This is the stomach. So this highlighting part stomach covers which part of the abdominal viscera? You can guess here. You can please fit this image in your mind so that you can easily you can easily memorize that content, whatever the content present in the posterior surface of the posterior relations. So basically our first part is diaphragm. First part is what? Diaphragm. Here we can appreciate here diaphragm. Diaphragm is present in the posterior relation of the stomach. So next thing is the spleen. Spleen is also present in the posterior relation of the stomach. So this is the spleen. And next is what? Next you can see here the kidney. Which kidney? Left kidney. Since the stomach related to what? Stomach is situated in the left abdominal, what we can say, left abdomen part. So it is related to what? It is related to the left kidney. So this is the left kidney. Understand? And above the kidney, which gland is present? Suprarenal gland is present. So this is the suprarenal gland is present. And one more thing is artery here. So this is the abdominal aorta. Abdominal aorta gives a trunk is known as celiac trunk, and celiac trunk gives a branch, one of the branch which goes to the spleen, which supplies the spleen, or also means the part of the, also supplies the what? Stomach. But here most important thing is that कि स्प्लेनिक आर्टरी क्या होता है यहाँ पर में प्रेजेंट होता है, तो स्प्लेनिक आर्टरी प्रेजेंट होता है यहाँ पर में. नेक्स्ट पार्ट, नेक्स्ट इज दैट we have seen what? Left suprarenal gland, left colic flexor also present. See, this is the left colic flexor, also related with the posterior wall of the posterior surface of the stomach. Understand? Next is body of pancreas. So this is the head of the pancreas and this is the body of pancreas. Okay. So these are the structure presents just posterior to the stomach. So this forming the stomach bed. Now let's see the trick about the stomach bed. So basically trick is doctor S3 kills patient mercilessly. Doctor S3 kills patient mercilessly. So what about the doctor? Doctor represents the diaphragm. S3 represents the three parts. S3 represents the three parts. First part is splenic artery. First part is splenic artery. Okay, next part is the spleen. Next part is spleen, and the most important is also what gland is present above the kidney? Suprarenal gland. Which suprarenal gland? Left suprarenal gland. So these are the part. Now next is kills the patient. Kills means kidney. Patient what represents the pancreas, and mercilessly means mercilessly what we can say mesocolon. Okay, so these are the posterior relations of the posterior and visceral relation of the stomach. Okay, so here you can see I have written down all these content here, so you can see here. Understand? So these are the structures forming the stomach bed. I hope you like the video and don't forget to subscribe my channel. Have a nice day. Thank you so much.